Thank you very much, and thank you for allowing me to testify on this bill that means so much to me. I began my legislative career working on the Healthy Youth Act. 6 years later, it was passed into law. And it was one of the most victorious things that I have experienced as a member of the legislature. I would like to talk a little bit about why it's necessary, why the repeal of it, what we are talking about today, is an absolute slap in the face to the many women and children and families who desperately rely on this type of information to make healthy decisions. There's so much to say, and I know I have 3 minutes. I'm going to try to stick with that to the extent that I'm able, without you dragging me out the room. I guess as the author of the bill, I am proud and maybe even a little defiant in my opposition to Senate Bill 237. It's a bill that repeals the Healthy Youth Act, and it returns us to an era of don't ask, don't tell education policy for Wisconsin's youth. And that's disturbing. I almost thought about exciting the room and bringing some condoms to the committee in order to show you that they're really not that scary. We can talk about these things. But I didn't want my gesture to be misinterpreted, so I chose against that route. The Healthy Youth Act revised some of Wisconsin's most archaic reproductive health education statutes. And it said that if a school board opted to offer sex education programs, that it would do so in a way that is medically accurate and age appropriate, focusing on core elements that are proven to reduce teen pregnancy and STDs. I am hard-pressed to find someone who would struggle with that mission statement. This has become a partisan, radical agenda type of issue that it does not have to be. I want my children to go to school and learn about something that is medically accurate, that is age appropriate, and that is based on evidence that shows that we can reduce teen pregnancy and STDs. Now, if there's someone else in the room who doesn't want that for their children, please raise your hand, and I'd love to have a conversation with you. Okay, well, good for you, sir. Hopefully the outcomes that those children don't receive do not befall on your kids. The reality is that, and the other piece of this is that it is not a mandate. It says if you choose to teach a human growth and development curriculum, you will include information that is medically accurate and age appropriate. It doesn't say you have to. If you don't want to, don't. But we're not going to give our children false information. I'm not going to have my children going to school hearing false information. And that's what I would hope we would do, whether it was math or science or English or anything else. So, as author of the Healthy Youth Act that got passed last session. I'm sure you heard me advocate on the issue time and time again, and talk about the innumerable benefits of this particular bill. And rather than run through these benefits or the data supporting it, I do want to highlight 3 concerns, because I know there are lots of groups and organizations here today who will be able to give you the data that the author of Senate Bill 237 didn't seem to have, but there is tons of data, whether it be from the American Medical Society, the Center for Disease Control. There is just a unending list of data as to why teaching our children this information makes so much more sense than letting them get it off the internet, or letting them get it off the TV, or letting them hear it off of rock songs, or letting them hear them off of rap songs.